And interfragmentary movement, as you can see here, between basically the loading between those fracture fragments, it's very important. And actually it was determined the most important mechanical factor. And that is actually determined by fixation stiffness and of course load bearing. That there is, depending on the tissues who want to form cartilage, bovine bone, or that lamella bone, there's a specific strain between the tissues that needs to be applied, and we can play that based on that mechanical environment. Of course, first implant comes, but also the patient has to be loading in that weight. That's where that weight bearing comes in. And how can we control it? So this is the added benefit, not only compliance, but we can actually calculate precise loading conditions for any specific patient to basically personalize it. And then the patient safely applies that loading. We take a CT scan after implantation of the implant, whatever it is, like plate, nail. In this case, let's say it was an intramedullary nail at the tibial midshaft fracture. We can calculate specific loading conditions to make sure that implant does not fail, but also promotes that natural, healthy healing response. So we want the most rapid, optimized healing based on that loading condition. And let's say we figure out, and of course the patient's weight bearing plays a huge role. So then we prescribe this load bearing based on this FEA modeling, and that's what it is. We can prescribe it in the app. Now that the patient should comply, patient follows the prescription. Let's say we said initially start loading 3 to 50%. And we can remotely monitor, make sure that patient is compliant to it. We have 16 clinic centers that are involved. We have 31 orthopedic surgeons that are doing this stuff. And so far we started clinical trials and we have 10 patients enrolled out of 90. As you can see, there's very little response because this patient had a little bit pain and she refused to walk. You should make them walk because bone is dynamic tissue, and if you don't load it, it would never heal. On the other side, you have this patient where we calculated precise weight bearing as tolerated. We wanted to build the maximum callus formation, which is about 8 to 12%, 8 to 10% of established strain that we can displace, not to damage that bone healing. And as you can see here, this patient built up amazing callus formation, had complete healing by 12 weeks.